So endometriosis is basically when the inner lining of the uterus. Endometriosis pain, you can have it even slightly before your period.
Endometriosis were a man's disease.
Maybe more awareness spread about it. Maybe more earlier detection would happen, because that is how most male diseases are treated, sadly. Where I think about 650 people came, and then we had some talks about endometriosis.
Would you like to be reborn as a gynecologist again?
Yeah, I think I've been asked this question by a lot of people. Say this is one of those fields in medicine where it involves a lot of medicine and it involves a lot of surgery.
How many IVF cycles could have been reduced or avoided by 30?
If she came to me at age 18, she would have no IVF cycles. Pain not controlled by medicines. That means the disease is very aggressive and you got to go in and knock it out before it does further damage.
Welcome to Feminine Systems, the podcast where we not only heal or empower women, we also reimagine systems around her. I'm Dr. D, an integrative gynecologist, an author and an entrepreneur. In India, women learn from a very young age that pain is a part of womanhood, and bearing pain is a sign of strength. Seeking pain relief or therapy or voicing emotional distress actually leads to a perceived, and it is seen as weakness or a privilege or a rebellion. But did you ever know suppressing pain, emotional and physical, shows up as somatization, autoimmune flares, hormonal imbalance, and mental illness? By somatization, I mean certain chronic pain diseases like migraine, chronic pelvic pain, can all be a root cause, which can be all symptoms of a root cause which could be much deeper and missed. We have culturally spiritualized and moralized pain. And more importantly, we have silenced sexual pain, we have minimized menstrual pain, we dismiss any pain, when a woman comes to you with. And therefore, the silent epidemic of endometriosis continues and thrives. Today, we have a very, very interesting guest, a male gynecologist and an endogynecologist to be precise. He's a laparoscopic surgeon and a fertility specialist, Dr. Damodar Rao, Associate Director of RAO Hospital, Coimbatore, who is going to, help us understand what is the cause behind endometriosis and everything about women's pain. Let's welcome Dr. Damodar Rao to a Feminine Systems podcast. Hi, Dr. Damodar. Very, very happy to have you on our podcast of Feminine Systems. And let me go to the questions with the basics. What is endometriosis?
Yeah, first of all, thank you for having me over on this podcast. It's lovely being here and talking about, issues related to women. Being a gynecologist, so I think it's a good start you've made.
Thank you.
And endometriosis is also a disease which is very close to my heart. We've been talking about endometriosis for a very long time. So endometriosis is basically when the inner lining of the uterus is found in other parts of the body outside the uterus, right? So this is why I have these diagrams here. So what you see here is actually the innermost lining of the uterus, which is called the endometrium. When this is found at other parts, that is if it is found on the tubes or if it is found on the ovary, it's called endometriosis, right? So I don't know if you can zoom in and if you can see these black dots that you see over here on the side, or it might sometimes even be as low as in the vagina. This is a side view of what we're seeing. The uterus is an organ where we have the intestines behind and we have the urinary bladder in front. So many times this the blood that comes from the uterus, it can collect and sit in various parts. It can sit on the intestine, it can sit on the bladder, it can sit on the ovaries or the tubes. So all these parts can get affected, and the blood that comes in these endometriotic tissues act like glue, I can say. So everything gets stuck to it. Okay. And many times it can even sit on the nerves and they have a lot of pain.
And cause a lot of pain. Okay.
So this is a disease which is known typically to cause painful menstruation, painful intercourse, and sometimes pain while passing motion also.
Okay. What is the difference between a normal period pain and a pain caused by endometriosis?
So this normal period pain is usually what period pain which you have on day 1 or day 2 of your periods, right?
Okay.
But your endometriosis pain, you can have it even slightly before your period, you can have it during your period. It can be very severe pain, and many times it can be even after your period. Other things are also, you might have this pain that occurs during intercourse, like I mentioned. This pain can also occur while passing motion. So these are all the ways you can differentiate it from a regular period pain.
Okay. So when does one get to, have to come for screening if they feel they are suspecting an endometriosis?
So like I said, if somebody is having pain outside what we have described as a normal period
Menstrual pain,
other than your day 2, day 3, if she's having pain before or severe pain during, some people even faint, some people have a lot of vomiting. And of course, like other things, like I said, pain during intercourse, pain while passing motion. If they have something like this, definitely go to a doctor. Don't just say that, I have to deal with this, or this is regular stuff. Or if your mother or your sister or somebody will say this is how it is and this is how it's going to be, don't. If you have a suspicion, immediately go to the doctor, and I'm sure the doctor will ask for a scan. Many times, even if you go to the doctor, they might just say this is regular pain. Maybe you insist on a scan.
Because culturally we are programmed for that women are supposed to endure pain, and pain is normal.
Yeah.
So this has been fed to us.
Yes.
So most people, just
absolutely.
take it
Even girls as young as 14, 15.
They have endometriosis.
If you suspect anything, don't tell them that this is normal pain.
Okay.
Always tell them that let's go to the doctor and see, rule it out. Once you've taken it out of your mind that it's nothing, then probably it's just a regular pain, and then you can manage the pain with just regular pain medication.
How do you diagnose endometriosis? Is imaging caught up, or is laparoscopy the gold standard to diagnose endometriosis?
Right now, imaging has really improved over the last few years. You have great quality ultrasound machines. You have MRI machines have also improved a lot. These can pick up your regular endometriosis lesions, like if the endometriosis lesions are seen in the ovary, it's called chocolate cysts. So you can see ovarian cysts.
I think many of you viewers would have heard of cysts. A lot of other cysts they've heard of. Chocolate cyst.
This is an interesting name for a cyst. Yeah. It's called a chocolate cyst because blood over time, when it just stays in a particular area, changes color. From red, it becomes brown.
And it looks absolutely like a chocolate sauce.
So every time I'm operating, I'm like, who wants chocolate sauce? So
So it just looks like chocolate sauce, and that's why it is called chocolate cyst.
It's called a chocolate cyst. So these ultrasound and MRI, the techniques have also improved of how to detect endometriosis. So there are centers which do imaging for endometriosis, and there are doctors who have studied this in particular because it's not very easy to pick up.
Got it.
So they have to know about all these lesions. They can pick it up, but still very, very subtle lesions like those we call superficial lesions.
Right.
They cannot be picked up by imaging, and still you need a laparoscopy to diagnose this. So in some cases, most of the cases, imaging will do good, but sometimes laparoscopy is needed.
Okay. How common is endometriosis in your day-to-day practice?
So like I was just discussing earlier with you, because I've been termed an endometriosis specialist by my colleagues. They refer a lot of endometriosis cases to me. So I think 1 in 3, 1 in 4 cases that come to my OP have endometriosis.
Okay.
And in general, if you look at statistics worldwide also, it's like almost 1 in 10 women in reproductive age group have endometriosis.
And 1 in 10 women in the reproductive age group, around from 18 to 45.
Yeah.
Okay.
And if you look at fertility practice, at least 1 in 5 have endometriosis. So we're a hospital that does both the laparoscopy side, pain management, and the fertility side. So we have a lot of endometriosis patients coming to us.
Is many times the infertility, which is termed as unexplained, most of the time, do you find it to be associated with endometriosis?
Yeah, see, many times endometriosis may not be in your face, even in terms of diagnosis. So even for the doctors, in terms of picking up the lesions either through symptoms or through imaging, can be difficult sometimes. It comes under unexplained because many times we're not able to pick it up either on a scan or on an MRI, because most of the places they just do the basic tests with the basic test like a HSG. That's basically a dye a dye which is pushed into the uterus, and then you have to see there are blocks or not in the tube.
Okay.
So that is a basic test that is done, and then you do a basic ultrasound scan. Centers that are not trained for picking up endometriotic lesions on an ultrasound scan may not be picking it up. So this is the reason why it comes under unexplained. It's there, but they don't know how to pick it up.
Okay, got it. Doctor, can you tell me, this is a very interesting observation, and some scientific studies also say, have you seen a pattern between personality traits and pain reporting? Because pain is a subjective phenomenon. What is painful for me may be not tolerated by somebody else. So do high performing the alphas and the type A personality women suppress their pain for a very long time before they approach a doctor?
Yes, this is an interesting finding, an interesting study. It is true that because people who are type A personalities, they're go-getters, they're so focused on their career that everything takes a backseat, even their own health. So even if they're suffering from a lot of pain, they would just endure through it because
or pop a pain relief.
Or just pop a painkiller, a quick fix, because they're chasing bigger things in life, according to them.
Correct.
But I have people who've been doing this, and then 10 years later they come to my clinic only to find out their fertility is gone and they've been dealing with pain which they could have not dealt with and probably improve the quality of life. So yeah, this is something that we have to kind of teach the public about what this is, and they should reach out. Hopefully they'll start reaching out to us earlier.
The topic for today's episode is pain and women. So what are the pain treatment modalities what you find we have right now, apart from the medical and non-medical options what we have?
Yeah, see, the mainstay, like we haven't discussed, that is of course painkillers, the usual painkillers that we give, like as simple as a paracetamol, which we all know as a Dolo or a Crocin. Even those could work for some people. Then there are hormonal medications which we prescribe that definitely do help reduce the pain. And if at all that's not coming down, then we do surgery for these people. What other people are, there are also non-mainstream kind of medications which have been tried out, like acupuncture, acupressure, cupping. Then there is something called TENS, TENS. These are nerve stimulation methods through radio frequency. These are all methods that have been tried, but no full, complete scientific evidence for them. It does give them some temporary relief. Temporary
pain relief. Sometimes even a behavioral therapy like psychotherapy methods like CBT and all can also help. As a laparoscopic surgeon, what surprises you most when you operate on an endometriosis patient?
Yeah, see, we see all sorts of findings. Many times they come with only complaints of painful periods, right? So you only think it's to do with the uterus. And then you go inside, you'll see that the large bowel is stuck, the small bowel is stuck. Basically, all the intestines are involved. You might see the urinary bladder is also pulled into the disease. Many times the ureter, that what carries urine from the kidney to the bladder, that also goes in the same path. So that can also be involved. So her symptoms that she talks to you in the clinic and what you see inside could be completely
contrasting, right? Sometimes it can be something mimicking a frozen pelvis kind of scenario also, like where all the organs are stuck together. So and
one more interesting fact about endometriosis is it can reach as far as the lungs.
I also wanted to know if endometriosis is a disease only, does it affect the reproductive organs, or is it confined just to the reproductive organs? Can it spread elsewhere?
Yeah, like I said, I showed you on this diagram that you have the intestine behind and you have the urinary bladder in front. So those endometriotic lesions can fall on the intestine, and the intestine can get affected, and that's why you have painful passage of stools. Or you can have painful passage of urine during your menses because of this. And some people have also coughed blood during their menses. So it's a very enigmatic disease. We have many theories that talk about why endometriosis occurs, but still there is not one theory which can say, yes, this is the reason why you're getting endometriosis. It could be congenital, that is you're born with it.
Okay.
Or it could be a problem with the development, Mullerian anomalies, like they say, basic development of the uterus, development of the organs. During that phase of the baby's life, endometriosis can get in, or it could be due to environmental factors. But they say it's a mix of most of these. So, yeah, it can go as far as the lungs.
Okay, interesting. Yeah, there is something called the scar endometriosis also, like for mothers after a surgical cesarean section especially. So those also, they say even that causes severe pain.
Yes. So these are again how after a cesarean sometimes the tissue from the uterus can get deposited in the abdominal wall after a cesarean.
Okay.
And that can start growing, and it causes very, very painful lesions during the period. Every time you have your period, the scar also hurts.
Correct. And
or sometimes women after normal delivery also, you have a small stitch in that area. Sometimes these cells can get deposited even in the episiotomy wound.
Okay.
And again, and medicines don't work for this. It is only through surgery.
Oh, we need to go for a surgical
It's only pure surgical. This is one of the endometriosis types where you do only surgery and there's no medicine sadly that work for it.
Okay. What are some common myths even gynecologists believe about endometriosis and endometriosis surgeries?
Yeah, one is, I was just talking about, now we've all become a group of surgeons called endometriosis excision surgeons. So
what?
Endometriosis excision surgeons, right?
Oh my God. See, I think the field of obstetrics and gynecology previously, what was like a DGO whom I used to go, or anybody 20 years back used to go, let's say it was a 2-year course and they were good to go. But today the field of obstetrics and gynecology is subspecialized into almost 10 different specialties.
Yep.
And now you are an endogynecologist. Endogynecologist means somebody not only who handles gynecology, but an expert in laparoscopy and hysteroscopy. Now you say I'm an endometriosis specialist. So is it even subdividing so much?
It is further subdivided. Like you had fertility specialists, and then you had obstetricians.
Yeah.
And then you had urogynecologists. Now it is one disease specific.
Disease specific. Yeah.
And like they also say, if you know endometriosis, you know all of gynecology. Because endometriosis is such a disease that involves all the parts of woman's life, stages of a different woman's life, right from fertility to afterbirth to her life at home, to her passage of stools. Like it affects every part of her life and every stage of her life. So they say that if you're an expert of endometriosis, then you're an expert of gynecology.
True. Is there a cure for endometriosis, a complete cure, or is it all symptomatic treatment which is available?
Actually, sadly, it is a disease that is probably going to be with you through most of your life, and you have to manage it based on what stage of your life you're in. Whether you're looking for fertility, then you treat the patient accordingly.
Okay.
There are medicines which will suppress the ovulation or suppress your menstruation, and that can halt the pain. But you cannot use those medicines if you want to become pregnant. So based on whether you want fertility, or if you finish your family, what your objective is, whether...
And can they develop it very later in life also? Or?
Yes. There are some people, first baby, no problem.
Okay.
Second time they're trying to conceive, and suddenly you do a scan and see they have these cysts. So they call it enigmatic endometriosis, right?
Yeah.
It can come at any part of your life.
Some common myths. I think you didn't answer that. Common myths which.
Yeah. So I was talking. That's how I think we're talking about endometriosis excision surgeon. So many times during surgery, a general gynecologist would just say, we don't have to touch this because it's very small, the lesions that you see.
True.
But they can be sometimes very deep. It's called tip of the iceberg disease. That is, you're only seeing a very small lesion, but when you cut it out and go inside, it can be very deep, even sitting on a nerve, just that spot. So that is something that you got to look out for.
Okay.
And there is also a myth that getting pregnant will cure you of the disease. Okay. That's also not true, sadly.
Okay.
But it can keep the disease at bay for some time.
All right.
Because you're basically not menstruating at that point. When you're pregnant or you're breastfeeding, it has minimal sort of suppressive effect for that particular period in time.
This is a taboo question. Most of the times in our consultations, most of the endometriosis patients don't have a conversation about their sex life. When endometriosis can steal a woman's sex life, it's a taboo to talk. to the partner or talk about it to the gynecologist? How does a woman, break this barrier and open up?
Yeah, I think because this is to do with how women are sort of brought up culturally, right? You're not supposed to talk about sex, or you're not supposed, or you don't even discuss it with your peers, and you feel
most people, no partners also, they don't discuss. That is surprisingly, the so-called good women doesn't talk about it.
Yeah,
right?
Yeah, that's what you've been taught.
Yeah, it's a very culturally.
So culturally, yes. So you're taught to like sort of deal with it, and maybe you think this is how it is supposed to be, right? Because you don't know what is normal.
What is normal? You've been experiencing it every time.
Yes.
And so it was like...
So both culturally, personally, also you think you cannot talk about it. And so you don't bring it about in the doctor's chamber also, because probably in Indian consultations you come with your husband and you come with your mother-in-law.
Absolutely.
And then they, it's not like a couple that is coming, right?
Yeah.
So that makes it a little more difficult to bring it out. And many times also doctors don't like we talk about in history taking, we should not talk about leading questions.
Yeah.
But this is one part of history taking where you have to lead. Correct. And you have to bring this out. You have to talk about this and, with both of them bring it out, because this particular thing itself might clinch the diagnosis of endometriosis without doing imaging also.
And it will say the location of it. Maybe that is
exactly.
It more the
this
UV
could
septum
also mean that there's a term called deep infiltrative endometriosis, which means it's a very severe disease.
Okay.
So when you ask, talk to your doctor for a scan, you got to tell her, look out in this area, she might be having some endometriotic deposits there. Because most of the scan doctors, the sonologists will just look at the ovary, they may not look at this particular area, like in the UV septum.
Correct.
So that's very, very good history to bring
it out. Yeah, most women either endure it or, they completely avoid their interest becomes lesser because of the pain,
and that itself is a reason for infertility.
Yeah, it's the reduced number of contacts. Yeah. So how does endometriosis cause infertility? What is the mechanism? Is it because of the tubal block, or does it have anything more to it?
So you can look at it two ways. One is a macro environment, that is, if you zoom out and just look at it, you know that it is there in the ovary and it is there in the tube, so it can block the tube or it can affect the shape of the tube. But if you look at the micro environment, there are toxins that are produced in the ovary itself by the disease, and that can have a deleterious effect on the quality of the egg, and over time it can damage the eggs also. So number of eggs also come down. That is one point. The second point is they talk about the micro environment in the pelvis itself in general. There's a little bit of fluid that is there in the pelvis around the uterus.
Normally.
Yeah? That also is affected. The contents of it are, it becomes more toxic. That is number two. And number three, they say, is after the fertilization occurs in the tube, that is after the egg and the sperm meet in the tube, the baby or the embryo has to go and fertilize in the uterus. So that's called implantation. That can also get affected because of this altered microenvironment.
Okay.
So there are various, macro and micro
causes of how it leads. What do you wish husbands, being a male gynecologist yourself, and partners understood better about endometriosis?
Yeah, that it's just not. Mainly what you see the woman complaining about is her pain during menses mostly. So they should understand that it's not just about pain during menses. This is a chronic disease which is probably going to be with her throughout
the rest of her life.
And she will need treatment based on what is her aim in life at that point, what phase of life. If she's for fertility, she might require some surgery, and a lot of understanding and care is required from your partner, because already her life is very difficult. So you got to be understanding and be supportive so that they can, go through this journey smoothly.
True. People, I see husbands dismiss this pain as, you always complain of pain, and they are not enduring the pain, and they just say you are making a fuss about normal period pain. So this is something which they are very less empathetic to a woman.
Definitely.
So I think men have to be considerate. Oh, it could be something bigger than the regular period pain. Even a period pain is actually painful. Most men, because they are men, they not
They don't know what
yeah,
it is. Yes.
For and this is like, it happens many times throughout the cycle. So for them to be more empathetic, if they say there is pain, it is really hurting them. That's why they tell you.
Yeah, yeah.
So,
and don't dismiss it. I mean, at
exactly.
least definitely go to the doctor and get a scan done, and at least now that you've heard this podcast and you know what it is, definitely get it out of the picture.
At least we can rule it out. Okay, so like if endometriosis was caught at 18 years of age, how many IVF cycles could have been reduced or avoided by 30? Because today I see a lot of women planning their pregnancies very late after 30. It's become a norm these days, and it is good that women are having their own choice and all that. So if I were able to catch it at 18, so
if she came to me at age 18, she would have no IVF cycles.
Okay. How is that?
See, one is you have to, first of all, you have to pick up the disease early. So if she would have come to me, definitely would have picked it up early. And number two is we know what medicine, we know when to give medications, we know when to stop medications. You cannot simply keep banging her with medicines. There are certain physicians will just say only medical management is enough for endometriosis. You got to monitor her, you got to see at least every 6 months you can do a scan to see how the eggs in her ovaries are. Is it coming down, the number of eggs? There's a test called AMH, anti-Mullerian hormone, that also gives us an idea of her ovarian reserve, the power of her ovary.
Okay.
Right? So
how many eggs she can, and the quality of eggs.
So it basically talks about number of eggs. Than the quality. But if you see there's a fall in AMH over time, or even on ultrasound scan, you can see the number of eggs in her ovaries.
Yeah,
or if you see the cyst
antral follicle count.
Yeah, antral follicle count. Or if you see the cyst is increasing in size, or her pain is increasing in size, all this means your medicines are not working. Then you have to definitely intervene. You cannot just tell her, deal with it, continue the medication for some more time. No. One more thing with medicines is, some people will just take the medicines for 2 months, 3 months and say it's not working. For these medicines to work, it actually has to be taken for a period of 4 to 5 months, and only then you'll actually see the change.
This is something I commonly see and know, because once they just want quick relief, and only pain relief is like very quick. Apart from that, everything, this is a disease, it's a progressive disease as well, and it takes some time to heal.
Yeah, you've not got the disease in 1 or 2 days, right?
Correct.
It's been in your system probably since you've been 17, 18, and you're feeling it only later on. It's become more intense later on. So something that's been there in your body for so long, the hormones also take some hormonal medication also take time. So the doctors also prescribing this should know that the hormones take time to act. So within 2 months, you may not see magic.
Maybe we need to give an explanation, reassurance. You need to take it for such a long time, because most people default after 2 months, and there is a reservation that taking hormones is going to have a lot of side effect profile for me. That's why people default also. They start feeling I might gain weight, or some kind of people say it has. They're so aware and educated, and everywhere Google also gives them so much lead that first thing the medicine is given, they go and Google it, and all the hormones have some side effects. And how does anybody, if they are prescribed hormone medication, how does a person ensure they adhere to the treatment protocol?
Yeah, exactly. So one is, the treating gynecologist should be an endometriosis specialist, and you should know what they should know in and out of the medicine they're prescribing. Okay, and you should tell, and see, at least in allopathic medicines, we tell the patients that there are side effects versus other systems of medicines where they don't talk about side effects at all. So if you tell the patient that you will have little bit of these symptoms, like little bit of hot flashes sometimes, or little bit of bloating you might have, which goes away with time. Some of them have a little bit of breast tenderness. All these things, you tell them that you will have it, then they accept it better. That is one.
Yeah.
You have to tell them the side effects. If you tell them, no, this is normal, but the patient is feeling it, then she might be like, there's a mismatch.
Correct.
One.
Correct.
Number two is, the doctor should know that this medicine takes some time to act. If you tell that to the patient also, she will accept it better. Now, we're in totally different time where patients also take a decision along with the doctor, right?
Yeah.
And they're very educated, so they read a lot.
Correct.
So you should be very open to the patient. Tell them that I'm giving you this medicine for this purpose. This is what it does. These are its side effects. But over time, you will get the benefit. Then they'll have the confidence in you and in the medicine.
Got it. Correct. So can you tell me about the role of egg freezing or oocyte freezing for endometriosis if diagnosed very early?
Yeah. So like I said, this 18-year-old girl comes to us.
Yeah.
And we see that probably her AMH is falling down a bit, or the ovarian cyst looks like it's increasing in size, or pain is increasing in size, and now she's probably say 24, 25. I would probably advise her to do egg freezing, because nowadays, of course, no woman wants to get married very young.
Correct.
She might want to have the option of getting married a little later. So egg freezing is a good option. That's like half IVF.
Got it.
Where basically you give them hormones to stimulate the ovaries to produce eggs. You take the eggs out of her body and you freeze it. So you're sort of freezing time, so to say, so that she can use these eggs later on for an IVF when she finds a partner.
How long can she keep her eggs frozen?
Oh, eggs have been frozen even for 5 years, 10 years. So yeah, but obviously the longer you wait, the earlier you use it, the better.
Okay.
And with knowing this fact, I will probably also try and convince her to get married a little earlier, or find a partner earlier, whatever it is. So,
okay. What is your opinion on the medical treatment options and surgical treatments before fertility treatments in a young woman?
Yeah, so before fertility treatment in a young woman, mainly we look at medical management. The first thing that I'm a surgeon, I'm a gynecologist, but I'm a laparoscopic surgeon. I love to operate, but the first thing that I would tell anybody or any doctor who's coming to train with me is, don't use the knife on her as much as possible. Stay away from surgery as much as possible, because you cannot, this is a disease that will keep coming back. So you cannot keep on, how many times will you operate on a lady? So one of the dictums that we have is, let her first surgery be the best surgery and hopefully her only surgery. That's
so
something,
delay it as
much as possible. Use medical management as much as possible. Use some amount of pain medication. Hormonal medication and pain medication, they sort of go hand in hand. If she's all right with this, then you can push it as much as possible. The indication for surgery would be, of course, pain not controlled by medication. Then definitely I'll go in and operate. It's not like because she's young you should not operate on her. This is the number one indication: pain not controlled by medicines. That means the disease is very aggressive, and you got to go in and knock it out before it does further damage.
Got it. Could you tell us something about the latest treatment options that have come in endometriosis management?
Yeah, if you look at it medically, there are the hormones itself have gotten better. There was something called, might get a little technical right now, but I'm sure you guys can sort of look it up later on. But there was something called GnRH agonist, which would take longer time to act. The agonist, through the agonist mechanism, which takes some time and then it suppresses. Hormonal. Yeah. Now there are antagonists, which will immediately suppress.
Okay.
So it doesn't take time to act. So before, like I was saying, it takes 3 months for them to see some relief. This you will see some relief immediately itself. These are called GnRH antagonists. That is.
How long can somebody take these medicines?
Oh, you can take at least for 3 years. They say that you can take this comfortably. And especially hormonal there's one particular Dynogest is one of the hormonal medications that even up to 5 years they can take it. But you always have to see that your calcium levels, that you're taking enough calcium. Correct. All this you got to look into.
Yeah.
So you need to come to a specialist who will know that, this, I'm giving you this medicine, this is for your pain, and we don't want to operate on you, but you also have to keep a check on your calcium levels and your bone density and things like that.
And take supplements if necessary.
Take supplements as required.
Yeah.
So that is on the medical side. And on the surgical side, of course, we have laparoscopy. Now we have this laparoscopy with ICG. We have a 3D laparoscopy at RAO Hospital. It is with ICG. It's called indocyanine green. It's particularly a dye which we push into the body, and it differentiates structures for us. So we push it into this tube that carries urine from the kidney to the bladder, because that comes into the way of surgery and we have to really protect the ureters.
Correct. So, because once the organs are stuck together, it is a challenge for the surgeon.
Oh, yes.
However an expert you are, still it is very,
Absolutely.
there is a chance of injury, right?
Yes.
So
this 3D laparoscopy and this usage of this ICG dye in these surgeries really help differentiating structures. Precision is a lot more. So your chances of injury to an organ is very less. So I haven't, thank God, had an injury in a long time. But it's a part and parcel of surgery, and we counsel the patients that this can happen.
Is there.
It's always there.
Yeah. So I wanted to break the monotony. I thought we'll do a rapid fire for you. So You are a male gynecologist. Very few opt to become a male gynecologist. Would you like to be reborn as a gynecologist again?
Yeah, I think I've been asked this question by a lot of people, and I would say this is one of those fields in medicine where it involves a lot of medicine and it involves a lot of surgery. So it involves, usually either you're only a physician or you're only a surgeon, right? So it includes both, which I like. I like both medicine and surgery, so it's great to be there and practicing both. And it's one of those fields where there are a lot of very happy moments, like, through your fertility treatment, people become pregnant.
Absolutely.
And when they have a baby, they are indebted to you for life. I mean, they will always remember you, and you don't have such happy moments in other fields of medicine. So, yes.
Yeah, it's more of a joyful.
Yes. Oh, yeah, absolutely, absolutely. And anywhere they see you, they'll remember you.
Correct.
Because you gave birth to their baby.
Correct.
So
Correct.
It's a great field to be in, yes.
One thing that isn't normal about period pain.
Period pain, definitely if you have it before and during and after, like we were talking about triple dysmenorrhea, what it's called. It's called triple because it's before, during and after. That's not normal. Or if you have a lot of bloating and pain while passing motion, that is also not normal. Definitely go and get it checked.
Got it. Worst advice you've heard someone give to an endometriosis person?
I've heard one of the relatives telling them that you should probably drink green tea and lie down upside down half an hour for every day, and your symptoms are going to go away because your menstruation is going to get reversed by it.
Okay.
So yeah, you have all sorts of
everybody gives their random
free advice is available very easily.
What's something you wish every teenage girl knew?
One is you should know what normal periods are. And if you have anything outside what a normal period is, like that we've already discussed, I won't be going through it again. Like I said, triple dysmenorrhea or pain during while passing motion, definitely go see the doctor. Do not accept anybody telling you deal with it, right? You have to tell your parents or your mother that you want to go to the doctor and get it checked. Because if found out early, things can be prevented.
Sure. This is my favorite question. So, if endometriosis were a man's disease?
One is, I think it would definitely get more funding. Maybe more awareness spread about it. Maybe more earlier detection would happen, because that is how most male diseases are treated, sadly.
So, because
hopefully it will get more attention with what you're doing and what we will be doing. I think we have this foundation called FemI, which is Foundation for Endometriosis and Menstrual Disorders India, and we're doing a lot of awareness activities about it. We had a walkathon where I think about 650 people came, and then we had some talks about endometriosis. We had some patients who were treated by endometriosis by me, and even they came on stage, and it was wonderful. I mean, they were so happy, tears of joy, and then they have children now. They also came on stage and spreading awareness about endometriosis.
So that's what the foundation is.
That's what the foundation is about. Right. We just started it 2 years back, and we've done about 150 surgeries also under the foundation. And also we do a lot of awareness camps. That's the main thing, because everybody knows about a fibroid, everybody knows about cancer cervix.
And regular cysts, especially any cyst. Even PCO becomes like a very big cyst.
PCO also. So I think PCO is also, people talk about it, but I think now endometriosis is becoming more common, and people have to know about this because it's something that, the progression can be halted if picked up early.
True, very true. So, can stage 1 or stage 2 endometriosis cause infertility, or is it only the advanced stage disease?
No. Any stage can cause infertility, because even stage 1 or stage 2 can alter the anatomy. That is, how the tubes are supposed to be free flowing and on the side, and how the ovary is supposed to be close to the tube. Even stage 1 and 2 can alter this anatomy, and such small lesion, changes can affect the fertility.
And as you said, the microenvironment, the toxic environment.
Absolutely, the toxic environment will also affect, fertility.
So, any diet or home remedies which help in the treatment because this is what for everything we have a home remedy, right?
I mean, I wish I could say that there was some real home remedy per se, but there is no magic food that is going to cure you of your endometriosis, sadly. But I think just stick to a healthy diet and a healthy lifestyle that can, sort of mildly elevate your symptoms.
And reduce progression in a way?
Progression, not really. I would just say sort of exercise and things like that, release endorphins in the body, which would sort of elevate the pain.
Yeah.
Yes.
All right. So, is there any role for cognitive behavior therapy for pain management, pelvic floor physiotherapy, mindfulness, and certain other complementary medicines?
Yeah. I wouldn't just say allopathy is the only thing. It would be the mainstay of treatment. Other things like your complementary fields would definitely help, like counseling, because this pain can start off as pain in the uterus, then it becomes pain in the brain, right?
Correct.
So even counseling and your alternate field of medicine, like I was talking about acupuncture, acupressure, all these definitely complement each other, and definitely they have a role. But it cannot be used as the only treatment.
Only treatment. It can support and supplement.
Yes. Don't stay away from mainstream medication and surgery and only use this as a mainstream of treatment. Use this as complementary.
Got it. Nice. So you have actually briefed almost everything about endometriosis. This would be such a eye opener for anybody, be it a doctor or be it anyone who's watching this show. Almost you've covered, and you're doing a great job on with this endometriosis foundation. We from Feminine Systems, we wish you a very, very, very successful endeavor in the foundation to create awareness throughout the country and grow bigger. And this is something, a very meaningful conversation for me personally, because women are always are made and asked to endure pain, and most of the time any of her concerns are dismissed. So this particular episode where a woman's pain or her woman's concern is not dismissed is something what I wanted to actually bring out. And any of your you want to convey anything to our viewers who are going to be predominantly women, and we are focusing on men to become better partners. So being a male gynecologist and who have been very much closely associated with the reproductive problems of a woman, so what would you like to tell our viewers?
One is, I'm happy that we're discussing about endometriosis itself, which is completely unknown to most people. I'm glad that this podcast happened, and we've spread awareness about it. For young girls, those who now know about the disease, don't stay at home, don't deal with the pain, don't accept to be asked to be dealing with the pain. Definitely make an appointment, reach out to your physician, and we're always there to help you. And for the partners of people with endometriosis or who are on a difficult reproductive journey, it's not the same for everybody, right? So be understanding and be supportive, and if that happens, then you'll definitely have a good outcome, and maybe that outcome will also happen earlier than if you're not very supportive, and then things could go downward. So that's what I would like to say, because when I'm talking about reproductive health in general and people are trying to conceive, you only hear about the happy stories.
Correct.
Nobody talks about, oh, I had an abortion, or nobody talks about it, and many women undergo it. Culturally, we've been told, don't talk about it.
Don't talk about it.
You're pregnant, don't talk about it until the 12th week, because something can go wrong. That's all right. I mean, things can go wrong, but it would be great if people spoke about it so that we normalize it. Correct. Because if you don't talk about abortions, or that we have gone through an abortion, the woman is lying there thinking, why only me?
Right. I want to record it here. I've gone through a miscarriage myself. So, and I've seen many people whom I know, who are not my patients, but I really have seen a lot of people have it. But it's better you don't tell anyone. It is. I think to normalize the biological, happenings of a woman actually also.
Absolutely.
These conversations help people to open up when they have, like you say, when they have a difficulty during their intercourse, and people can talk about it and they can open up. And so, as you said, we can diagnose earlier. This can help change a lot of, the health scenario of the current, at least when we are calling the modern day women, at least we should create an ecosystem which actually favors them.
Let's not stigmatize any of this.
Right.
Let's talk about it more. So when you talk about it more, you kind of know that it's normal, and a lot of people are going through it, and then you don't feel so bad about it.
Absolutely.
Right.
Absolutely. Thank you so much, Dr. Damodar, for being on our show. And
thank you. Thank you so much for having me.
A very, very meaningful show for us. So thank you. Thank you all.